You just leave it at the camera. Because she has to show it. She has people here watching it. Mm-hmm.
Hi.
Hi.
Multiple sclerosis affects approximately 250,000 to 350,000 individuals in the United States and is the most common disease involving the nervous system. There are three main points to touch on. First, what is multiple sclerosis and how do you diagnose it? Second, what are the symptoms of multiple sclerosis? Third, what is the treatment of multiple sclerosis? Using these three key points, I'm going to inform you about multiple sclerosis. First, let me inform you that multiple sclerosis is what multiple sclerosis is before I move on to these three main points. What is multiple sclerosis? Multiple sclerosis is a neurological autoimmune disease which involves the central nervous system, which is the brain, spinal cord, and optic nerves. MS is an incurable and progressive, which means there is constant degradation of nerve cells and lasts a lifetime once it develops. The purpose of the nervous system is to convey messages to the form of electrical currents that travel along the nerves to the muscles and tissues, which allows to move. In order to allow the efficient transfer of nerve impulses along the axons to the tissues, the nerves are insulated by glycolipid substance known as myelin. Think of it how metal wires are insulated by rubber or plastic. Now let me tell you about how multiple sclerosis is diagnosed. Multiple sclerosis is clinically diagnosed with a history and neurological exam. Paraclinical exams would include a spinal tap and MRI. Spinal fluid analysis, the brain, the spinal cord is bathed in a fluid called cerebrospinal fluid. In some instances, the patient undergoes a lumbar puncture, also known as a spinal tap. This is done to make certain that some other disease is not misquadrating MS. The oligoclonal bands and the IgG index are abnormal in about 90% of MS patients. An MRI is a non-invasive method available to detect areas of a demyelination, which is the damaged myelin around the nerves. MRI is safe and accurate, providing the clearest evidence of white matter lesions in the CNS. And this is also used to monitor disease. Let's move forward to the symptoms of multiple sclerosis. The symptoms of multiple sclerosis include, but not limited to, common symptoms are fatigue, numbness in extremities, weakness, balance problems, and vision loss. Not all symptoms affect every MS patient. Not every MS patient experiences the same symptoms. Symptoms are not always present. Sometimes they subside from time to time. Most MS patients have episodic patterns of attacks and have remission throughout the disease. Sometimes the attack can leave the patient with certain degrees of permanent impairment. Multiple sclerosis isn't curable, but there is treatment to control the symptoms. There are two categories for treatment for MS. One is for symptoms, and the other is to control the attacks and progression of the disease. 6 different products have been approved by the FDA as disease-modifying treatments for MS since 1993. These include 3 interferon beta products, which is Betaseron, Avonex, Rebif, and 3 unrelated products, Copaxone, Tysabri, and Nevatrone. Early treatment makes a big difference. The treatment of MS has changed dramatically in the last decade. A more favorable outcome and better quality of life are definitely more attainable by people with MS through appropriate and aggressive management. Multiple sclerosis doesn't mean your life has ended. Multiple sclerosis affects many individuals in the United States and is the most common autoimmune disease involving the nervous system. MS can be clinically diagnosed by a doctor and require diagnostic procedures. MS isn't curable, but the symptoms and progression of the disease can be controlled by MS medications. Thanks for listening to my speech about multiple sclerosis.